Thank you. Good morning. So this is the outline of our health authority. So we're covering all of British Columbia. In general, we have about 15 kids on dialysis at any one time in the province, about 150 children with chronic kidney disease in our chronic kidney disease program, and about 50 children we follow with kidney transplants, although we have a unique multi-organ transplant program at Children's Hospital. So the services that we're trying to provide is 24/7 on-service call to all of British Columbia and the Yukon. We do inpatient care and consultations at BC Children's, and all of our outpatient programs, again, at BC Children's. We've got an amazing chronic kidney disease program, dialysis, hemodialysis, and multi-organ transplant program, supported by great multidisciplinary teams. And we also have a lot of general nephrology clinics in addition. We're also a Royal College of Canada training program, so trying to train the leaders for tomorrow. And we're, on our spare time, involved in many research projects and quality initiatives at local, national, and international levels. So the challenges we face is that we're trying to provide service to the entire province from Vancouver. And the other issue is that many primary care physicians are challenged by the complexity of our patients. So while we'd like to tell our patients, go and see your family doctor for this other issue that's maybe not specifically kidney related, if they have kidney disease, they may also have a related syndrome, other organ involvements, and it's not so easy just to tell them to go back because the primary care physicians aren't necessarily comfortable in dealing with even the common issues within these patients. And while we'd like more of the basic care to be provided within the province and by some of the pediatricians, there's a lot of differences in the way that they're practicing, and even common issues are dealt with very differently across the province. So some of the initiatives that we've come up with to try and deal with these issues, and the one I'm going to talk about today is patient-engaged clinical care pathways. We've also developed specialty clinics in addition. Within our general nephrology, we've now got nephrotic syndrome clinics and hypertension clinics. And with partnership with Child Health BC, we've starting to establish some outreach clinics across the province as well. So in thinking about what we wanted to achieve and how we were going to go about getting a good clinical care pathway, we thought about what are the most common reasons that children are referred to us. So some of the big reasons are nephrotic syndrome, hypertension, and congenital anomalies of kidneys, so kidneys that just didn't develop properly. What conditions have the potential to progress to renal failure and require more support within our clinics? Well, there's subpopulations within all of those groups that have a chance of ending up in our chronic kidney disease clinics. So what conditions in the early phase could be appropriately managed by general pediatricians? Well, I think all of those conditions apply. And then the big questions are, how do we provide support or guidance to the general pediatricians in the community so that they can help to manage these kids closer to home? And how do we provide support and engage patients and families in their own health management? So in looking at the clinical care pathway, the first step is in auditing the current practice and seeing, is there actually a need for a pathway? So the first one that the team tackled was nephrotic syndrome. So is it being managed differently? Are the outcomes likely different depending on how you manage it? And we looked at our own clinical practice and the information that was sent to the patients that were referred to us, and the answer was yes. There was a big discrepancy in how this is being managed in all different areas. So they established an interdisciplinary care team. So the main leads on the nephrotic syndrome pathway were Dr. Matzel and Mammon, and we had a lead, Marissa Katapang, as well as our dietitian, Nani Polderman, and they formed the core of the team. And then they went about looking at all of the evidence for creating a best pathway for managing this, and they reviewed every decision point. So what's the proper diagnosis? You would think that's well established, but in fact, there's differences in the way that people will diagnose nephrotic syndrome. So what's the right way? First treatment, generally steroids. What dose do you use? Huge variation on that. How long do you keep it for? How do you wean it? Every different decision point went to the literature, looked at the studies, analyzed the grades of the studies, the qualities, and had long discussions about what each of those steps was going to be. If there wasn't good evidence in the literature. Then we did audits of our own clinical practice. So we've got a good way of keeping track of all of our different charts and diagnoses. We were able to go to those charts and try and answer some of the questions that weren't available in the literature. And this was actually a really great way to get a lot of research products, quality initiatives, and get trainees a lot of their research requirements, because we asked all of the questions. Is there practice variation? Served a good research question. What are the right things to look at for biopsy to know whether you're going to get minimal change, because we don't want to biopsy those children, or a different disease. So each of those steps was really analyzed. And then we got to the form where we thought they had a workable pathway. We got the families involved and says, is this going to work for you? What do you think about this? This is what we're going to recommend. This is how we think you can keep track of your health, and got feedback from the families. And then went about developing handbooks for both the families and the pediatricians. And so these are what they look like. So there's a parent's handbook specifically for the families with information all about the disease. There's worksheets for them to keep track of their prednisone dosing and what the urine dip shows for protein and when they go into relapse and remission. And there's a physician's handbook to go to the general pediatricians in the community. So the chapters that are in the parent's handbook cover diagnosis, so why your child gets the swelling, what protein losses are about, the types of nephrotic syndrome, your child's first visit to the doctor, complications your child might develop, treatment, so particularly medications, what the potential side effects are, diet limitations, so salt and fluid restrictions when you're nephrotic, vitamin D and calcium when you're on steroids, immunizations and infections, a huge issue in pediatric care, what to expect for ongoing care, and a whole bunch of appendices that cover tips for the commonly asked questions that we get. And this is an example. So on the left is a schedule of the visits, so the families know how often you're going to be expected to come to our clinic and what exactly is going to happen during that clinic visit. The blank worksheet is for them to keep track of their urine dipstick results, prednisone dosing, their weights, any other comments about how their patients were doing, and we encourage them to bring them back in so we can review the course of their treatment with them every clinic. And then the physician handbook for the pediatricians, all of the chapters mimic what's in the parent version. So diagnosis of nephrotic syndrome, types of nephrotic syndrome, evaluation when they initially present, recognizing and treating complications, the treatments, the diet, immunizations and infectious disease, and follow-up after initial presentation. And there's lots of great information in these for the general pediatricians as well. What do you look for when they physical exam when they first come in? What are some initial lab investigations? What are typical and atypical features of childhood nephrotic syndrome? So in other words, if you've got the atypical, that's when you refer to us. And indications for kidney biopsy. So again, if your patient has these things, that's the appropriate time to send them to us. So some of the benefits from a patient and family perspective is they get an active role in the child's health management. They know what to expect when they come to clinics and with treatment. They've got information that answers a lot of the commonly asked questions, and they're able to receive their care closer to home through their general pediatricians. And for the pediatricians, it allows them, empowers them to keep them in the community and provide that care, and they know when's the appropriate time is to refer to nephrology. So some of the things we learned along the way, it takes time to do it properly. I think every decision point was at least a 2-hour discussion with the team. You establish a core team, and then you bring in additional experts as needed. So we had our infectious disease experts to come and form the infection and immunization chapters. Expect modifications after a trial period, so all of your best efforts, as soon as you roll it out, things are going to come back, better ideas, a better way to do this. Establish a good way to track outcomes for your future audit of clinical practice, because you want to know in the end that this is actually improving the things that you want it to do. So we've got specific charts set up to collect all the information on what it is that we want to improve over time. And all of our patients have been consolidated into a specialty clinic. So next steps, rolling it out to the pediatricians in the province and knowledge translation. A nephrologist handbook is coming for ourselves. So when the patients come to us and we need more than a first-line medication, what is our standard of care going to be? audit the pathway outcomes, look at new evidence as it comes available, and we're going to repeating the process with other conditions. So we're working on the pediatric hypertension pathway currently. So I'm speaking on behalf of the Pathway Committee, but the bulk of the work has been done, again, by Drs. Mammon and Matzel. Marissa Katapang is the lead of the program, and Nani Polderman with a lot of consultants. I'm welcome to any questions.
There are microphones around the room, and we'd ask if there are questions so everyone can hear. Thank you.
Thank you for that's very interesting stuff. I'm actually curious if there's an app for that, like, or whether, because just thinking about the pediatric population and the parents of kids are all going to have their iPhones, whether that's something that's, it just sort of strikes me as an intuitive thing.
Okay,
that would
so
make
that's
sense.
what we need to learn about next time point. Yes, absolutely. It would be very helpful. We've got them in electronic version, which helps us disseminate them. So if we get a call from a pediatrician up north, we can email the PDF copy to them. We have our own Excel worksheets for all of the prednisone dosing, and it automatically calculates weaning schedules, but we don't have an app for the worksheet, and that's absolutely what a lot of people are asking for.
Especially for the patient version.
Yeah,
that's great.
Yeah.
Actually, I had a comment, really, that, and reading through this, it just seems such an incredibly sensible idea. I thought, where is this for the adult world? You know, I mean, all of those branch points that you mentioned, the taper, how many times do patients get these medications wrong? And as much as you stress, you must do this right. So I'm definitely learning and getting ideas as well.
I don't think it's a unique idea. I think it's the same way that a lot of the provincial programs are rolling them out. We've just managed to narrow it down to a specific topic and really get a specific information out to the patients, and I think it's very helpful for them. Yeah.
Great. Okay, and I think we have another question here.
Hi, my name is Irene. I work for First Nation Health Authority, and I'm one of the remote nurses way up north. I also have my CNF. I used to work for Interior Health, and my question is that with children that we get into our clinic, because we don't have physicians, we have to send them on to Prince Rupert to the physicians, and I don't believe we have a pediatrician up there as yet, because our pediatrician had retired. So my question is, these books that you have that we can have some sort of guideline, can we get copies of them?
Absolutely, and I think they're soon to be posted on probably the Children's Hospital website, and then there's Child Health BC is also helping advocate